One of the things that I actually worried about when I saw that, because he didn't quite land on the tubercle, it was a little bit more like this angle. Now that makes me concerned about a quadriceps strain. I'm Doc Faisal, orthopedic surgeon with Move Smarter Health. We are sponsored by an educational grant from Kinesi Movement. I love sports. I love talking about injuries. I take care of shoulder and knee injuries, and I operate and treat on them. And please consider this an educational, informative video only. Here we go. Green Bay Packers, Josh Jacobs. Do you like how I lowered the voice? Just give it maybe a little more soothing, appease the viewers, because I'm wearing that shirt that everyone hated. Yes! I wore this on purpose for you. You know the comment you made about the shirt? Here it is. Josh Jacobs. Apparently a contusion on his knee. You saw the play happen. He landed right on it. Lots of chatter about what actually happened. We know it's a contusion, but what does that mean? What's a contusion? What's a bruise? Bruise of what? No one's saying. What is it a contusion of? You can contuse anything like, oh, but what's in there? Well, what's in the knee? We're gonna use a fresh knee for this. Actually, shall I get Charles? Charles! Ah, there we are. Finally get to use him. Okay, you can get a contusion like that, right? Whoa. I shook the whole house with that contusion. So landing, boom. You can land like this, 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 hyperflexion, 90 degrees, dashboard injury, straight on like that. You can do all sorts of contusion. But what exactly is the contusion? Is it just a bruise on the skin? Well, what's under the skin? Oh, let's open it up. Let's take a look. All right, so skin, fat, fascia, down onto the patellar tendon, patella. You got the quadriceps tendon, patellar tendon, and then underneath all that, you have, well, you got the bursa and the soft tissue and the capsule and all that sort of stuff everyone's talking about, but what did he contuze? We don't know, but there's so much going on here. Cartilage, bone, and you could end up with any type of ligament, menisco, capsular. You could even pop a blood vessel, and that's all you have from the capsule, and you get a hematoma. We don't know that. They'll say contusion, but what exactly is it? So, sorry, why'd you go away? Charles! So, did he land on his kneecap? Okay, maybe he bruised that, but wait, there's more to it. Because under the kneecap is the cartilage, and that cartilage impacts this cartilage. That's how the knee moves. So if you contuse that, you can have damage to your cartilage that could be minor, could be major. I mean, one of the big things that we learned about bone bruises was when we started seeing, this was probably like decades ago, I know it was decades ago, probably in about, you know, the 80s, it was probably in the 80s, and then MRI was still sort of finding things, especially for the ACL, and you identify this thing called bone edema. Eventually bone bruise was a way to describe it to patients. And what exactly was it? Well, what people found when you had an ACL tear, we talked about this before, you have this subluxation, more often on the lateral side, boom. That pop is actually bone on bone contusing, and that causes a signal. Because basically what happens in MRI is you get protons flipping. That's what the magnet does. And the amount of signal and degradation and flipping of the water molecules and the hydrogen atoms results in different signal intensities that gives you an image. It's not a true image, but it's an interpolation of what hydrogen atoms do, and you get a visual image of what the knee looks like. Indirectly. There's no camera in there, okay? So, it's not like an X-ray where you're, again, X-ray, it's like you're getting an image relatively based on the X-ray beams. But with an MRI, you get what's called this edema. And now, is it the bone edema or is it a cartilage contusion? Or is it just a bruise of the tissues or the soft tissue? Now, typically when they say contusions, my biggest concern goes, is it cartilage or just bone? And if it's cartilage, then what are the long-term ramifications of this? And we see that with ACL, because no matter what happens, if you tear your ACL, you will get arthritis. Let me say that again. If you tear your ACL, you will get arthritis. It doesn't change. You can get your ACL reconstruction, you can function, you can play, but you will get arthritis. Can we repeat that? Can we just put it on a permanent loop and someone mix that in? You will get arthritis, okay? So, all the data shows that. Your gait, your walking function, your overall kinematics of the knee never returns back to what it was pre-injury. And that's another reason why there's so much we don't know. Like, it doesn't matter how many different types of ACL reconstructions there are. I'm not saying he has an ACL tear, but it doesn't matter what kind of surgery you do, you still can't get the knee back to its normal kinematics. So then the question comes, do we even know what normal kinematics really are? Because everything we're measuring is indirect, it's cadaveric and all that. We talked about that. Insert prior loop here. You will get arthritis. Okay, so contusion. That's what I was talking about, right? Do you like how I kind of go off on tangents just for fun?
You love arthritis.
But they love it. They love it as much as they love this shirt. That's why they're commenting on it. Let's see how many comments we get on that. All right, so what are other things that can happen? Now, I'll use the destroyed knee. It's not fully destroyed, but when you land like that, what else can you do? Okay, so let's imagine you hit the implant, you impact the ground like this. Okay, what can happen? This can stay and that can move forward. Look, this is what it looks like, right? Actually, hey Charles, do you mind? Watch this. This is your knee. This is your knee on drugs. I'm kidding.
It's only going to hit a certain audience.
Yeah, I know. No one knows about that. If you were born like less than 20 years ago, you have no idea what I'm talking to when it comes to those commercials that used to be there with the egg frying and, you know. Anyway, so here you go. Knee is flexed. Boom. Look what just happened, okay? Now, I'm not saying that's actually what actually happened. I mean, we're kind of exaggerating. This is not what's really happening to a knee. This is not a live knee. This is not a live knee. This is fake. This is fake. But the truth is that this is the mechanism. Now, he could, if he landed here, okay, not so bad. You throw in the patella, which I broke somewhere. You land on the patella, right? You will get arthritis. Okay, so I gotta stop. Otherwise, someone's gonna make a ridiculous, stupid meme of me and make fun of me forever, and I will be recorded in history as the least watched meme in the world, right? Yeah, that's what Joey says. It's okay. You love me. That's why you're here. Right, anyway, so, okay. So, this type of injury would probably like one of the worst case scenarios where the impact occurs sort of at the tibia level, and then what ends up happening is that you get complete displacement and dislocation. Obviously, I'm exaggerating it, but that results in a PCL tear. Now, you can have other things associated with that, but you can also get hyperflexion ACL tears, depending on where you land. You can get meniscal injuries, you can get posterior root, anterior root, you can get patellar tendon. One of the things that I actually worried about when I saw that, because he didn't quite land on the tubercle, it was a little bit more like this angle. Now that makes me concerned about a quadriceps strain. So you can contuse the patella, which could contuse the articular cartilage underneath, but then you strain the quadriceps and maybe even the patellar tendon. So that's actually where I'd be concerned about. And they say that there's nothing about him needing surgery, nothing that he tore. It's 4 to 6 weeks, apparently.
No, he's week to week.
Oh, he's week to week.
Yeah.
So he's week to week, apparently, and we don't know all the details. And again, this is not specifically related to Josh Jacobs' knee. I'm not the treating surgeon. I am providing you a contextual educational component about what could happen in an injury such as that. And I'm wearing the cool shirt. So, a lot we don't know, a lot we could know. He's week to week with some type of a contusion, the anatomical location of which we don't know. So there's a lot of assumptions that, oh, it's just a bruise. Well, 10 years from now, if that's a contused cartilage of a significant degree, that, wait for it, you will get arthritis.
So, coming back too early from a bone bruise,
Yeah.
and coming back too early from a cartilage bruise,
Yeah.
and the potentials for a bigger injury.
Yeah, so one of the challenges with any type of injury, now first of all, like there are a lot of bone bruises and cartilage bruises or contusions that we don't know what the long-term ramifications in the short term are necessarily. We know that long term, that when things happen, they occur. Now, usually more than likely, it's like any injury. You're favoring it. Do you get, and that's why I'm worried about the quadriceps, the proprioception, and the balance, and his overall kinematics when he recovers from the injury, because you will get some degree of favoring of that limb when you have the injury, right? So that means the long-term, or sorry, the short and medium-term ramifications are, is he predisposed to another injury while favoring that leg? Absolutely. Klay Thompson, you guys know the story. I don't need to repeat it. He blew out his ACL after recovering from Achilles. That's like a classic, like red flag about what can happen if you don't fully recover from your knee and you get put back in the game too soon. And he was out for a while. He had multiple injuries. And hey, Klay Thompson, I'm not absolutely not criticizing any of your treatment or your decision or any of the doctor's treatment, whatever. But what I am saying, there is a lot that we actually don't fully know. And there's a lot we do know, but there is this, okay, so it was coined within the recent few years about data. There's a concept of dark data. I've talked about this before, okay? What do we know is in the spotlight. What we don't know is in this giant black hole of incredible, gorgeous, wonderful information that no one has really peered into. It's kind of what we're doing with Kinesi. We're kind of like unveiling this black hole, this dark data of meaningful value in real world kinematics. Like, can you imagine if we had our Kinesi platform measuring that knee when it landed? Boom! You have live visual kinematics from an incredible exosuit, second skin, that would have told you everything that's going on in that knee. I mean, that's sort of the goal. And obviously, was he wearing a Kinesi legging? No, he wasn't. That's okay. It's a product being developed. It's a startup. I've talked about it before. It's coming. So here's the thing. Given that we don't know so much, but I know a lot about injuries. I treat knee and shoulders quite a bit. And so whenever I see patients that come in with a knee injury, and it could be minor, but they end up favoring that, whether they're at work, play, or home, they favor it. That favoring of the leg can then compensate to the other side. It can affect your whole axial to appendicular skeleton. Do you like that? Yeah. It's a good visual, right? Right, yeah. Some people think I'm Italian. I'm not Italian. I wish I were Italian. Joey's Italian, but I'm not. But I have all these gesticulations. You can cut that out.
I'm leaving that. That's 100%.
Oh, God. Here we go. First the shirt, then the gesticulations. I'm done. You know what? I can never do politics, and I can never be on camera ever again. That's life. But I can talk about educational injuries, can't I? Does that answer your question, Joey?
So your biggest concern is just him favoring it and then causing some other injury?
Well, true. I mean, that's probably the biggest factor. Like if it's a minor contusion where he comes back from, great. He bounces back from it. We don't know the long-term implications. I mean, when I was with the FDA, we had an entire, group called the MRI group where we looked at and tried to understand how precise can we get on cartilage, right? Now, without going into specifics and any proprietary information or data or anything that we looked at, just based on the publicly available information, I can tell you that we don't have the MRI sensitivity and specificity that we could actually look at the cartilage every day, every week, every month and say, oh, there, it's getting better, it's healing, or oh, I see a gray spot of damage. We don't have that yet. We have the long term, like if you look at the contusion, cartilage contusion, let's assume it's a cartilage contusion, assumption 1. The contusion was cartilage. Then 5 years from now, let's say he gets another MRI. Could there be something? Could be. Typically, arthritis happens in 70% of cases by 7 to 10 years and about 90% by 20 years. We know that based on ACL data. That doesn't mean it happens with every type of contusion or injury out there. Let me be clear. Okay? Not every contusion can result in arthritis, but what we don't know is what's the grade of the contusion that leads to arthritis, and we don't even know in this case, was the contusion the bone, the cartilage, or other tissue? We don't know that. So could he be predisposed to another injury? Absolutely. But what if that contusion, say we don't have the precision yet to truly understand what the collagen fibrils are doing, and say there is a weakness in the collagen fibril layer, and that contusion may actually be occultly worse than what we can actually see with the MRI. And we have like pretty darn good MRI, 3 Tesla, but we're not seeing collagen fibrils, we're not seeing the Z lines, but we're seeing a lot, right? And so I use the Z line as an example because Z lines are actually in muscle, not in cartilage. There's other anatomical features and characteristics. So someone's going to comment down below, there's no Z lines in cartilage. Yeah, I get it. It's just a contextual example. Right. Okay, back to what we were talking about. So cartilage. So say we don't have that. So say something could delaminate. Could you shear something off that was contused? Well, what's the grade of contusion? We don't even have grade classifications unless you have arthroscopic or high level research grade MRIs to evaluate cartilage injuries. But that doesn't always cover cartilage contusions in a clinical setting, meaning the real world where everyone can see what's going on. So there are limitations of what we can and cannot see. So is he predisposed to an injury? It all depends. Now I sound like I'm in politics. Maybe. So is this a horrible shirt? No.
Very believable. You sold that.
I love this shirt. It's so seasonal. Thanksgiving is coming. Not this week. So, if he had a contusion of the bone and affected his quadriceps strain, if it affected, say he had a bit of a swelling or a bruise, so his capsule is constraining his ability to fully flex and extend. He has some pain. He doesn't have his proprioception back. He doesn't have quite his overall arthrokinematic balance in the real world of moving live kinematics, not just in the clinic or in the lab, but what he actually does on the field, and a relatively in training and practice. So there's a lot we don't know, but absolutely I would be concerned about another injury risk if he is favoring it and hasn't fully recovered from it. That's a nice little disclaimer, kind of like,
I like it.
it's a nice coverall protection.
It doesn't sound as political.
It doesn't sound as political either.
No.
See ya.